All right, so one of the main anti-Medicare for All talking points that we had to hear basically on loop throughout the entirety of the 2020 Democratic primaries from especially guys like our current president, Joseph Robinette Biden, was the famous question, how are you going to pay for it? Now, it was pretty clear from that time that this was an entirely disingenuous question because as a society, believe it or not, you're always going to have to pay for a healthcare system one way or another. It's just a matter of how do you want to pay for it, and is our current way of paying for it efficient or good at actually distributing healthcare to the entirety of our population? And the answer to that is ours is basically the single worst at doing that in the entirety of the developed world. Now, just to put that a little bit in perspective in terms of how are you going to pay for it, the United States already right now with our current largely privatized and for-profit healthcare system, we are already paying right now in total costs and in a per capita sense more than any other developed country on the face of the planet. Okay, so you can see here it's really not even close per capita health expenditure in selected countries 2019. And you can see here, United States stands well above every other country, Switzerland, Norway, Germany, Netherlands, Austria, Sweden. You can go down the entire list. Now, the reason I'm showing you guys this is because there is an X factor that is different between the United States and many of these other countries. And that X factor is the degree to which we allow the profit motive to decide our distribution of healthcare. Okay, you're always going to have to ration healthcare. You're always going to have to pay for healthcare. It's just a matter of how do you want to do that. The way we've decided to do that is rationing it by who has the fattest wallet. Okay, this has resulted in catastrophic consequences. We have lower life expectancies than countries that have barely a fraction of our resources and wealth. And you can go and look at it statistically by different health metrics and see that we are significantly underperforming given that we are spending this much more than everybody else. Now, I got a story here for you guys, a good breakdown from Wendell Potter, who is basically pointing out how our bureaucratic clusterfuck of a healthcare system is not only ripping you off in terms of how much you have to pay out of pocket for healthcare, something that should be guaranteed as a human right, but also how you're getting ripped off as a taxpayer and how our federal government is essentially subsidizing privatized for-profit health insurance companies straight out of our money that could have been going towards funding other social programs. Okay, so this is just an absolutely absurd story to put it in perspective. He says in 2021, 72% of United Health's $223 billion health plan revenue came from taxpayers, okay? In other words, came from the federal government. And he continues saying that 94% of its total US membership growth over the past 10 years was in government programs. Wow, okay, so we're gonna look at more details, but it seems like already that it's almost like our government is already paying for, healthcare. It's just that we're giving that money not towards actual people to go and get quality healthcare, but we're just giving it to these for-profit companies to stuff into their executives and their shareholders' pockets, okay? So let's just go ahead and get into some of the details. He says, as I noted in my last post, United Health Group made more profits last year than any health insurer has ever made for its shareholders, and considerably more than Wall Street financial analysts had expected. And investors were so impressed that they rushed to buy shares of the company's stock. Okay, so understand again, in the middle of a pandemic that has killed damn near 1 million Americans, we are talking about a health insurance company that is seeing record profits, okay? But he continues saying that that might not have surprised you, for good reason. United and other big insurers have reported record profits every year over the past decade, but what might surprise you though is that even if you are not enrolled in a United health plan, some of your money likely wound up in the pockets of United's already rich shareholders. That's because you and America's other taxpayers increasingly are fueling United's profits. So here are just some of the statistics that he throws out there to put this in perspective, because it's just absolutely wild the degree to which we are subsidizing basically shareholder value for this private corporation. So he says in 2021, United insured nearly 1.6 million fewer people in its commercial risk division, the part of the company in which United is actually the insurer, than it did in 2011. And the 7.985 million people in United's commercial risk plans last year, including people who buy coverage on their own through the ACA marketplace, are folks who typically don't have access to coverage through an employer. In 2011, United had 9.5 million in its commercial risk plans. plans. And he continues saying that by doing a little more math, you'll discover that 94% of its total US membership growth over the past decade was in government programs, specifically Medicare through its Medicare Advantage and Medicare Supplement plans, marked with largely AARP, and the state Medicaid programs it administers. And when you do just a little more math, you'll discover that 72% of the $223 billion in revenue United's health plan division took in last year came from you and me through the taxes that we fork over to Uncle Sam and the additional premiums many Medicare beneficiaries pay the company to cover their out-of-pocket expenses. Okay, so let me just give you a pretty basic rudimentary redefinition of what he was just saying there. Okay, basically what he's saying is you have this private for-profit health insurance company that is actually not even largely providing health insurance as a product. What they're basically doing is being an unnecessary bureaucratic middleman who are price gouging people by charging employers and charging, Medicare and Medicaid funding programs to basically profit off of those programs and profit off of employers through their own health insurance plans to then handle some of the logistics of the administration of healthcare, okay? In other words, they're not providing anything. They're not providing anything of substance at all. This is a company who you could simply delete from existence and have the government itself through Medicare and Medicaid run these programs directly for these people, and it would be significantly more efficient, okay? And you could cut out literally billions and billions of dollars that are being funneled into these executives and shareholders' pockets, okay? So you have a private for-profit company that is going to its investors and going to its shareholders and bragging about the fact, oh, we've increased our market share, we've increased the amount of people who are coming under our services, right? And the people they're talking about are people who are enrolled in government subsidized health insurance programs, okay? So it's just a complete unnecessary mafia-like middleman who are price gouging us and walking out the back door with your money in multiple different ways, okay? Through your employer who takes a cut of your wage to pay for your health insurance plan, taking a cut from you in out-of-pocket expenses that you have to fork over when you go and get your medicine or go and see the doctor. And then on the back end of that, taking money from the federal government to subsidize their profit margins. It's just at every single level, you are getting ripped off and fucked by a corporation who should not even exist, okay? This is a lesson in why the profit motive should not exist in any capacity whatsoever in a healthcare system. Okay, we are going to be paying for healthcare. It's just a matter of how you want to do it. Do you want to send tens and tens of billions or hundreds of billions of dollars subsidizing for-profit corporations who have a direct financial incentive to deny your healthcare claims, to make you pay as much out of pocket as humanly possible, to basically price gouge the American people? Or do you want to actually put that money and those resources towards funding a healthcare system that is public, that is available to everyone free at the point of service, and actually provides higher quality healthcare as we see in plenty of other OECD nations around the world? So it's just, again, it's such an obvious problem with such obvious solutions in an industry like this where, of course, in this hyper-capitalist hellscape that we live in the United States, is only allowed to exist in this country, okay? This type of a healthcare system does not exist in any other countries, and they all have their own problems and shortcomings, etc., but this is pretty unique to the United States. And just for a couple more things to put this in perspective, just to end off this video here, he says an employer-sponsored family plan, just to give you an idea of how much this has increased in cost and how much we are getting price gouged recently. An employer-sponsored family plan cost an average of $13,770 in 2011 and $5,700 in 1999. And last year, okay, it was $22,221. Now, is that because our healthcare system dramatically improved? No, not at all. It's basically just because they have innovated ways, as we're often told under a capitalist system. Oh, capitalism innovates, right? Yeah, they innovate ways to further rip you off, okay? That's basically the only innovation that exists under a capitalist system in healthcare. But they continue saying that, meanwhile, deductibles that families have to meet before their coverage kicked in has more than doubled over the past 10 years. And when you combine premiums and deductibles that families have to pay before their coverage kicks in, the total is now more than 10% of a family's household income in 37 states, up from just 10 a decade ago. And he also says that, as the Commonwealth Fund reported earlier this month, because incomes have not kept pace with premiums and with increases in premiums and deductibles, health insurance is taking up a larger and larger percentage of household budgets. And to make matters worse, workers are making wage concessions for a company benefit that often covers less of their healthcare costs. So again, you see what the lesson is at the end of the day. It's the same lesson that I preach about a million different ways on this channel, and I'm going to keep saying it as much as physically possible until something is done to change this, completely absurd and perverse healthcare system that we currently have. Understand this. At the end of the day, we're going to have to pay for a healthcare system, okay? We're going to have to, ration care, if you want to call it that. But the ways that you do that are the important thing, okay? Do you want to do it based on who has the fattest wallet, or do you want to do it based on need and who actually needs healthcare and access to healthcare? And when you do something like invest in a single payer system like Medicare for all, it's something that saves money over time, okay? We have plenty of studies that prove that Medicare for all is cheaper than our current system. And you don't even have to take a leap of faith to understand that, because the existence of corporations like United Health, as he's pointing out in this piece, they're completely unnecessary middlemen. So this is why we are paying more per capita and more in a total sense for our healthcare system and getting lesser results, while at the same time you have Americans having medical bankruptcy be the leading cause of bankruptcy in the country. Nearly 500,000 Americans go bankrupt every single year due to healthcare costs. You have tens and tens of thousands of Americans who die because they don't have access to quality healthcare. So there's absolutely no reason for corporations like this to exist at all. You got to get the profit motive out of healthcare and plenty of other industries as well, because you can see that they are only corrupting it.